everyone. My name is Alex Grady. I am a supervisor here at Central Ops for Life EMS, and I'm going to be running you through a quick training on the new Powerfields that we are going to be implementing soon. So before we begin, I just wanted to talk about some of the key changes that we have made to the system. Before we had auto-generated narratives, and even when we developed the auto-generated narratives, you would generate your narrative and have all the PPNs, the pertinent positives and negatives, in the narrative itself that you would fill out and you would free type in. Now we have converted those PPNs into Powerfields and a couple other sections in the narrative as well. So there's really no change in content. It's just mostly where you're going to be finding the fields to fill them out. And a lot of them are associated with the primary impression in the provider impression section. And with that, we have found an issue, just a limitation with the Health EMS system, is that when selecting the primary impression, it may be a little slow to load all of the various primary impressions that we have in there. So just a little piece of advice is that you take about 5 or so seconds, wait to make sure the system can load the primary impression list. If it takes longer than that, then maybe you want to select it again. But don't keep hitting it and hoping that it will come up, because that will cause some severe lagging in the system. But we'll talk a little bit more about the specific changes that have been made later on in this training. So first, we're going to open up a form, and I'm just going to take you through a couple of the changes. They are pretty straightforward, so there really is not too much to go over, but just a couple of key points that I want to point out to everybody. First, the biggest change is going to be when you come to the chief complaint section. The thing that you want to understand most about the new system is that you need to link your primary impression to which narrative that you want to actually generate. So for example, coming through here, if I select a primary impression of, let's say, cardiac symptoms, all of the information that you had to fill out individually in the narratives before are now Powerfields that are associated with specific primary impressions. So as you can see, they're all the same questions with a couple of alerts and such things like that. They're not in any particular order here. You just have to go through and individually read and understand what you're filling out. Like always, red exclamation point, that means that it is required to export. So if I select just a couple of things, go through. As most of you have seen before with most of the Powerfields, that as you select different things in the Powerfields, some of them have already come through onto the narrative. So I'm just going to fill out a couple of things so that you can see what I'm talking about. And then as I come over here and I select, what I want to select is the cardiac symptoms PF for Powerfield. Then I generate, and everything pulls through onto the narrative here. Now, one of the biggest things that I do want to note is that, let's change to respiratory or asthma symptoms. And you can see that you have this lightning bolt here. Those are the primary impressions that have Powerfields with them. Only the primary impression in the provider impression section has the Powerfields associated with it. So if you did want to do a secondary impression, you would need to utilize your primary impression as the primary issue of what is going on with the call itself. So you would not want to, if you wanted to fill out the cardiac symptoms narrative because it was a chest pain primarily, but there was also a respiratory component, then you would have to, I would say, select it as a cardiac symptoms or a chest pain patient so that you can fill in it'll automatically fill into your narrative. So just a couple of things here. I'm going to select a few of these, but not all of them. As most of you have seen so far in the auto-generated narratives with some of the Powerfields that are associated with it, you do have to make sure that you're filling out all of your Powerfields. So let's say that you don't fill out your Powerfields. So we're going to generate and we're going to replace this one. Just to show you the PPN for the respiratory, we did fill out a couple of the sections that it required, some of the Powerfields, but some of them came up as not entered. That's important to see that it says not entered before typing anything else in so that you can go through. I'll go through the entire narrative real quick and I can see that everything that has been selected as not entered, I can go back, select the primary impression again, and make sure that I fill in all of the required sections. Once I go through and I made sure that I filled them all out, then I can go back, generate, replace, and all of those different Powerfields do select in, except for one not entered. So we would go back, and we can go back and we can keep going back and making sure that we filled in what is necessary and whatnot. But what we can also do, and this is totally up to you, if you've already typed some things and you don't want to get rid of it, because if I do type some things into my narrative and I generate and replace, I will lose everything that I just typed. So what you can do is you can just select it and then you can just type there no. It should make it still things a lot quicker for you and as you go through, because there is a lot less that you're actually tapping into the narrative section here and trying to fill in small things like yes or no. Another thing to note as you go through, it does not fill in everything in the narrative, as you can see. There are some sections of the narrative that you still have to fill in like you would before. It's just trying to, the whole point of the system is just making things a little bit quicker for you. So you have to read and make sure, document any changes to the patient condition during the transport. You have to type in there. Any other run numbers here that were in the same ambulance, you have to actually type in there. Let's see, going through here, then, as most of you have seen before, there are a couple of Powerfields here in the transported section, but now there are a few more that you are going to have required. Bed confined questions will be here. The condition that qualifies the patient as bed confined, who you transfer care to, the room or location that you transfer care to. That is all in the number of patients transported section, but you will see that they will all be required to export. And as you go through your narrative, you can see that these are Powerfields that were not entered. I would always suggest that you go back and fill out the Powerfield because it's still going to be required to fill out, to actually export your report. So I would just fill it out and then come back and replace your narrative and regenerate it. A couple other smaller Powerfields that we did include. As you will see, the cardiac arrest narrative has been shortened quite a bit because of the the large section here in the chief complaint area that you actually are required to fill out for every cardiac arrest. So as we go through and we select cardiac arrest and give it a moment to load all the Powerfields in, we do have a couple of sections through here that I just want to bring your attention to. That if you select, let's see, if you select the time of death, there we go, pronouncement time, then it will have you select the agency that took custody of the patient. So let's just say right now, and then we can say GRPD, for example. And then up here, it looks like, there we go, they are filling in. Sometimes you will have a little bit of a glitch. I would always suggest just clicking out of it and clicking back in, and you can see what is necessary to actually fill in properly. And so you can see all the complaints prior to arrest, when was the patient last seen and by whom. So we'll just select a couple of things here so that we can go into the narrative real quick, and we can select our cardiac arrest narrative, and we're going to replace. And as you can see, we have everything that we typed in there is now in this section here. And then if you wanted to use, let's say, the pronouncement on scene section, then you can see you have your time of death that is linked into your narrative as well, and who the patient was left in custody of after the patient was pronounced. So going through, so something just kind of backtracking back to the concept of having a cardiac symptoms patient who also has respiratory distress. If we wanted to select cardiac symptoms and we generate, we're going to replace real quick. So we have cardiac symptoms, but we also want to select the patient has respiratory distress. So what we can do, I'll cancel that. What we can do is we can select respiratory distress, respiratory Powerfield, generate. And what we're going to do on this one is append. And then we can take all of the questions that we answered for the respiratory as well, and we can just move that up here underneath so that we have the pertinent positives and negatives of a respiratory call as well. And then what you're going to have to do individually is delete everything else that does not apply or is redundant. And you're going to have to delete it yourself and just kind of make it fit in there a little bit better. Okay, and that's really about it for the Powerfields. As most of you have seen before, the Powerfields have been implemented in little spots here and there, and they do, some of them do get pulled into the narrative. They are pretty self-explanatory. The red exclamation points are what is required, and then there are extra pieces of information in there that they may ask that is not required, but will help increase your documentation ability, and will help you kind of focus what you need to write for each individual patient. So pay attention to all of those, read all of the questions. It's very simple. It will just ask you a question, and then you just have to answer that question, and it will hopefully be a lot simpler, a lot quicker for you. And if you have any questions as we roll this out, feel free to email me at my email listed here. It will also be listed at the end of this training. Thanks, and have a good rest of your day.